audience. I, Saif Ahmad. Today we are going to discuss about topic Parkinson disease. So as we all know, Parkinson is a chronic progressive degenerative disease of nervous system which is characterized by tremors, rigidity, akinesia, bradykinesia and postural instability. Okay. Now, Parkinson disease occurs in about 2% of the population more than 65 years of age. Risk of Parkinson disease increases with as we grow. Okay. Now, there is an equal number of occurrence of Parkinson disease in men and women. Smaller percentage in younger onset. Okay. Then, etiology. Etiology basically is the how Parkinson disease occur. Then here the basal ganglia. First we have to know what is basal ganglia. Okay, basal ganglia is a part of the central nervous system present in the brain, which is responsible for voluntary movement, okay, postural stability and other types of movements in the body. Okay, in this in the Parkinson disease is used to refer to a group of disorder that produce abnormality of basal ganglia function. Okay, that is postural instability, involuntary movement, etc. There is a three types of etiology in Parkinson disease. First is primary Parkinson, then second is secondary Parkinson, and third is Parkinson plus syndrome. Okay, primary Parkinsonism is the most common cause, affecting approximately 78% of the patient. Then secondary Parkinson is associated with different kinds of disease like infective, inherited, acquired, etc. Okay, the term Parkinson plus syndrome refer to those conditions with symptoms of multiple systemic degeneration. Then what is pathophysiology? As we discussed earlier, basal ganglia, Parkinson disease is caused due to the basal ganglia disorder. Okay, basal ganglia have composed of putamen. There is a type of cells which is present in the basal ganglia, which is composed of putamen, caudate, globus pallidus, subthalamic nucleus, and substantia nigra. So in the Parkinson disease, there is only a defect in the substantia nigra, which is responsible for generation of dopamine, that is our neurotransmitter. Okay, in substantia nigra there is a dopaminergic neurons which secrete dopamine. Okay, in this there is a loss of dopaminergic neuron leads to reduction in spontaneous movement. Okay, thus the patient wants to move but cannot move. As the disease progress, neurons degenerate and they develop characteristic cytoplasmic nucleus body called Lewy body. Okay, now here we can see there is a part in the brain, that is a basal ganglia, and in the basal ganglia there is a nucleus called substantia nigra, which is responsible for dopaminergic production. And here you can see there is a non-Parkinson red nucleus, and in this there is a Parkinson disease where we can see the Lewy body, formation of Lewy body. Now clinical manifestation. First is rigidity. Rigidity is defined as the resistance to passive movement that is not velocity dependent. Okay, it can be in flexion or it can be in extension. It is of two type rigidity we can see in Parkinson. First is cogwheel, then second is lead pipe. Lead pipe is like a spontaneous rigidity occurrence in the whole movement, but in cogwheel rigidity there is some jerky resistance that will happen. Okay, then akinesia. Akinesia refer to the difficulty in initiating movement. Okay, the patient of Parkinson disease unable to initiate the voluntary movement. Then bradykinesia refers to the slowness and difficulty in maintaining the movement. Then next, there is another clinical manifestation which is most common, that is tremor. Tremor is involuntary oscillation of body occurring at a slow frequency. In the Parkinson disease, the most common type of tremor we can see is resting tremor, and it is manifested as pill rolling tremor. Okay, just imagine you have a pill in your hand and you are rolling it with just like this. Okay, now this is the manifestation. Then last is postural instability, demonstrate abnormality of posture and balance. The patient of Parkinson disease unable to maintain its proper posture and balance, okay, because as the base of support narrows or as attention demands, very postural instability increases. Then there is other clinical features called masked face. In this, the patient facial expression is become diminished, okay. Then there is some of musculoskeletal changes like muscle weakness. There is an increase in fatigue, and there is a less or reduced flexibility and contracture development. Okay, now there is some other orthopedic condition which is associated with Parkinson disease, such as kyphosis, scoliosis, and other diseases. Then there is a gait disturbance. In this, there is a specific pattern of gait. In the Parkinson disease, mostly there is a shuffling, and it is also called fascinating gait. As you can see in this picture, the patient is unable to maintain his COG on the in the base of support, and there is a postural and balance stability also, and there is a trunk and pelvic motion also diminished. Okay, then there are other clinical feature also. Okay, in this there is a difficulty in swallowing and communication, visual disturbance, and also cognitive and behavioral deficits. Okay, then how we can diagnose this Parkinson disease? Parkinson is usually made on the basis of history and clinical manifestations or examination. Okay, the diagnosis of Parkinson disease can be made if we have at least 2 of the 4 cardinal feature as we discussed. There is a tremor, rigidity, bradykinesia, postural instability. Okay, now how we can measure this disease course? There is a scale called Hoehn and Yahr scales. It is divided into 5 stages. First stage refer to the minimal or absent unilateral if present. Second is minimal bilateral or midline involvement of clinical manifestations. Then third is balance impaired, some activity are restricted, patient can live independently. Okay, then in fourth, symptoms are present more severely, the patient unable to stand and walk, and it become more difficult. Okay, now then the last stage is the patient will confined to bed or wheelchair, and it is mostly all over dependent to other people. Okay, then what is we come to the treatment, pharmacological treatment. In this, there is a drug called levodopa or L-dopa. We basically give to this due to the levodopa maintain the dopaminergic level in the body, and reduce the clinical sign and symptoms. Okay, then there is a other disease, that is MoAB, monoamine oxidase inhibitor. This drug reduces oxidative stress on neurons. Okay, then we can also give anticholinergic for tremors. Then we come to the surgical management. Here is a stereotactic surgery. Here in this, there is a lesioning of the brain. Okay, in this there is a other type of surgery called pallidotomy. Pallidotomy is the known as destructive lesion in pallidus. In this type of surgery, we destruct the nucleus of globus pallidus. Okay, then there is a deep brain stimulation. In this, there is an implantation of electrodes in the brain where they block the nerve signals, and that causes the symptom like tremor, postural instability, rigidity, and bradykinesia. Okay, then there is a last treatment called rehabilitative treatment, which consists of rehabilitative exercise, flexibility exercise. PNF here refers to the proprioceptive neuromuscular facilitation, then mobility exercise, balance training exercise, and at last gait training exercise. Okay, the end. Thank you.